This episode was graciously sponsored by California Cryobank, the #1 sperm bank in the U.S. Head to cryobank.com today to start your search and use promo code PREGTOG for a free Level 2 subscription to their donor catalog. As you know, this podcast is about surrogacy, donor conception, fertility treatment, and all the ways a modern family is built. And today you will meet Marea Goodman. She is the host of the community Pregnant Together and also has a platform on Instagram by the same name. And she supports the modern family. So if you are part of a queer couple or a single parent to be, you will be especially interested in this platform and also in this podcast. But even so, if you're not, you will be fascinated by the things that she shares and the conversations we have. So tune in. I think you're going to love this episode. Welcome to Building Your Family. This is a podcast about donor conception, surrogacy, and all the ways the modern family is built. My name is Lisa Schumann. I'm your host. I'm a researcher and author, and I'm here today to share with you a special guest that I have who will show you a little bit about our future. She will show you how we are going to look into the future of family building. We're seeing a lot of different sorts of family building methods and ideas and family formations these days, and I think we'll see more and more in the future. And it's really important that we're educated and informed and really compassionate about everybody's journey. So I'd like to introduce you to Marea Goodman. She is the owner and founder of Pregnant Together on Instagram, and is doing an amazing job running a community that is so supportive and loving. I've actually joined it myself, and I think it's fantastic that she helps everyone through their family building journey. But I won't say any more. I'll just introduce you to Marea. Thank you for coming.
Thank you, Lisa, for having me. I'm excited to be here and share about Pregnant Together and talk about all the different ways that we can support creative families.
Great. So why don't we start at the beginning? You are a midwife by profession. So maybe you could tell us a little bit about how you started from midwifery, how you built your own family, how you decided to build this community, and really what's it all about, and what are your thoughts about modern family building?
I started as a home birth midwife. I'm a licensed midwife in California. I attended my first birth in 2011 and spent about a decade really focused on providing prenatal care during the birth, and postpartum care. In 2016, I learned how to provide insemination services. And so started doing inseminations mostly for the queer community. I've always been very out about my identity as a queer person in my profession, which has been wonderful privilege for me to be able to bring my personal identity into my profession. And then also about the same time that I learned inseminations, I started growing my own family. And so my partner at the time, who is also a midwife and was the person to teach me inseminations, she had a 7-year-old and was actively trying to get pregnant as a solo parent by choice. And we got together during that time and so created a blended family together over the course of a couple of years. And then I ended up getting pregnant in 2020 via IUI. So we have 3 kids together. And it was really through the process of experiencing pregnancy myself and realizing how much I didn't know, even though I'd been in the profession for over a decade at that point. It was very striking to feel kind of blindsided by how vulnerable so much of the process was for me. And at the same time, I was working on writing the book, Baby Making for Everybody, because there hadn't been a resource for queer folks and solo parents since The Ultimate Guide to Lesbian Conception, which I think came out in 2000. So my co-author, Ray, and I started writing this book to really develop resources to support people to know how to get pregnant, how to find donor sperm, if you're trans, how long does it take if you're choosing to go off gender affirming hormone therapy, all of these different things. And we wanted to include a lot of community voices. And so through that, through the personal experience of being pregnant and then tapping into all these community voices in the process of writing the book, I really wanted to create a place where people could come together around this really not spoken about, very vulnerable journey of growing our families. And so that's how Pregnant Together came to be. And it's a membership site through Mighty Networks. We have hundreds of people all over the world. We have folks in Slovakia and Belgium and Canada. And most folks are based in the US because that's where I'm based. And we just have so many queer people, solo parents who are connecting and talking about all the unique experiences that are involved in growing our families in these particular ways. And I'm really excited about the power of community and what we can bring to each other during this process. So I'm just like really inspired by what we're doing.
That's so wonderful. And it's so nice to see because, of course, a long time ago, this was not possible, right? It was so hard to get a community. I know decades ago, I tried to build communities at the Gay and Lesbian Center in New York City, and it was so hard to get a group together. But when you're on the internet, you have so much more reach and so much a greater ability to support people. And that is so fantastic. So if you could kind of take me back a little bit and share with the audience, I guess people probably are wondering, well, what about this home insemination situation? How do I go about that? And why do I need somebody other than my partner? I'd like to have it be this intimate experience with my partner. Why should I have a midwife? What would you say to that?
Well, a lot of people don't even know that that's an option. And
Mm-hmm.
midwives aren't doing home inseminations in every state and every place. So it depends where you live. But there are many of us. I also train midwives to do at home IUIs, intrauterine inseminations. So, and it's worth checking out. I think, a lot of people assume that they either need to do it completely on their own or go into a fertility clinic. And
Right.
there is absolutely a place for fertility clinics, especially for folks who have fertility issues.
Mm-hmm.
But, as I talk to most folks about, the fertility clinic industry grew out of a need to support heterosexual couples who were experiencing infertility. And most of them are not focused on serving people who are growing their families with donor sperm, who may or may not have fertility issues and benefit from the medications and the monitoring that they can provide. So I think the at-home midwife insemination option is so wonderful because you can stay in the comfort of your own home. You can have that intimate experience. Like when I do inseminations, I place the catheter, and then if there's a partner involved, I'll have the partner be the one to push the syringe down and do the actual insemination. And then we talk about everything. We deal with all the logistics, and I leave, let myself out of their house, and they can have their, 20 plus minutes of bonding connection time. And, when you're spending money on donor sperm, the chance of conception with at-home IUI versus doing it yourself, the ICI, or the intravaginal insemination, it basically doubles your chances of getting pregnant. And so with the cost of donor sperm being so high, I generally recommend the intrauterine insemination because it just greatly increases your chances of conception.
And what do you find your community is struggling with? I know that there's so many different issues that are happening now and so many things that people feel scared of, feel worried about. Certainly you raise this issue of stopping your hormones if you're transitioning. And I would imagine that you probably have a lot of advice for people in that area and all the sorts of feelings that might come up for them if they get pregnant and conflicting feelings. So there must be a lot of things happening within that community or for the people that you see who really need to kind of deal with these things, in vivo as they're building their family, being prepared for the feelings that are going to come up, being prepared for the relationship issues, being prepared for all of those things. What are some of the things that you're seeing?
Great question. I think a lot of people talk about some gender feelings and challenges when it comes to trying to get pregnant and being pregnant in this world that, really insists on feminizing the experience of pregnancy and family building. So we have a lot of people that are queer, genderqueer, trans that feel worried about experiencing dysphoria or are going through that process, and
Right.
being able to talk to each other and kind of have a home where they feel understood, because there's nowhere in mainstream society yet that really supports that experience. So I would say that's a big one. The other big issue is, if people are taking a while on their journey, navigating, accessing higher levels of care. We have a lot of questions about folks who have a known donor and their sperm count is suboptimal. And when does it make sense to go to IUI or IVF? Or should we take letrozole or Clomid? Or how are folks feeling with the trigger shot? And so people are connecting around those questions too, and learning from each other about best ways to give themselves injections for the IVF process and things like that. That's a very sweet thing. And then so every month I do one workshop that I lead, either about choosing a donor, tracking fertility. We did one on miscarriage and infertility. And then I always have a guest speaker every month as well. And everything is recorded and provided as resources for people moving forward. And so we have a webinar on herbal support for trying to conceive. We have Brent Monsieur coming on to talk about fertility interventions for queer families.
He's great.
And
I love him.
you helped me make that connection. So I appreciate that. We're talking about healing from birth trauma, supporting LGBTQ plus relationships. So really building a lot of resources for people to feel more supported during this time. And there's some fun conversations that we get to have. And I think it's really unique because just to provide people a place to feel that their full experience as a queer person growing their family is recognized. Because I think a lot of the time in the queer community, the process of procreating in whatever way that happens isn't always centered and honored. And then, of course, in mainstream society, the queer experience is not centered and honored in that conversation around how we grow our families.
And do you see more of a need from your audience within the how to build a family, or is it really because you're a midwife? Do you see a lot of struggles with getting pregnant and getting through the pregnancy and delivery and early baby issues and all of those things as well?
I say Pregnant Together, we do preconception through parenting. I created this series of weekly emails for people to receive from 4 weeks pregnant to 6 months postpartum. And we're really building a lot of resources in that early postpartum. And then we have live support groups for parenting and all these different stages. So I would say from the preconception time, people join when they're like just thinking about maybe starting to get pregnant and, want to start wrapping their minds around what supplements to take or whether or not they feel like they can handle it with their mental health around the gender dysphoria question, all the way through, we have folks whose babies are 2 years old at this point. And my hope is that we will continue to grow. And as people's children age, we'll continue building resources for folks during this whole stage, because I have a 3.5-year-old, an almost 7-year-old, and a 14-year-old. And each stage brings its own complexities.
Own challenges.
Yes.
Yeah. Very complicated. Yes, I know.
Yeah.
Living the teenage years is not fun. Although they say it's God's gift for sending your kid away to college, because then you don't mind so much.
It's so funny.
It's hard.
When you're up in the middle of the night with a newborn, you're like, oh my gosh, like this, that theoretically it's not always going to be that way, but then they're like so sweet and they just want to cuddle you. And then you have a 14-year-old who doesn't want to spend any time with you, but you're sleeping through the night. So, each stage brings its own benefits and challenges. Yeah, for sure.
Yeah, it's such a trade-off. So one of the things I find a lot, we could talk about different families, and if you have some other thoughts, please share. But I think for the listeners, some of the challenges that I see. So the first one is the lesbian couples or the couples born without any sperm. And there's a lot of struggle sometimes getting to the fertility clinic, right? Because there's so much that we might not know. If there's a diminished ovarian reserve, if they're blocked tubes, if they're whatever is going on that you may not know about, right? But very often you get into this relationship and think, okay, it's just all I'm missing is the sperm. So there's so much hyper focus on that's the issue, right? This is where I'm looking is the sperm is the answer, but it may not, time is not kind to ovaries. So,
Right.
there are other issues that can crop up over time. And sometimes I get very worried about my patients who get into this kind of stuck position where they're just really focused on the insemination and really trying to make the at-home insemination as nice as possible and the sperm donor and all of that. And they're really not thinking about, well, either A, I could have an issue, or B, what about baby number two? I'm already 34 years old. Oh, I'll take my time. It doesn't matter, right? And so I think that sometimes we get, when we're trying to be so supportive and warm and comforting, sometimes the kind of practical, concrete pieces, I think, get pushed aside. And then what breaks my heart is then the patients suffer.
Yeah, I hear you. And I think in my fertility practice, I've really shifted in recent years because we are seeing higher rates of fertility issues and the cost of donor sperm has doubled since the pandemic. And I'm definitely quicker to recommend fertility evaluations than I was 5, 6 years ago for people. And, generally the framework that I recommend, because I do see a lot of people that are like, we really want to at least try to have this intimate, comfortable insemination experience with as little intervention as possible. So I counsel people on their health history, their family history, their menstrual history, like whether or not they're seeing very clear ovulation signs, and whether or not it makes sense to get a fertility workup before starting to try to conceive. The general framework that I recommend is after 3 inseminations, if you haven't gotten pregnant yet, to try something else. So, to either get a workup, make sure there's nothing going on. It's normal, completely average for it to take 4 to 6 inseminations to achieve a pregnancy for folks who don't have any fertility issues. So you're still very much in that normal window, but because of the just high financial and emotional cost of trying to conceive with donor sperm, I do think that it makes sense to check all of your bases and make sure that there isn't something going on that you would benefit from a higher level of intervention.
Yeah, that's great.
Yeah, I think the 3 is helpful.
The 3 months.
Yeah, the three attempts. I've also seen people try with a certain donor for 3 months and then change donors, or do it at home by themselves for 3 months and then get help from a midwife. I think it just offers a container that I think can be helpful because it can be a challenging process. Someone in my community said IUI is bad for my mental health. And that is something that has stuck with me because, I think it really can be. I think there's so much hope, there's so much planning, there's so much money and logistics that go into each insemination. And it's important to do what we can to conserve all of those mental, emotional, and financial resources as much as possible.
Yeah, for sure. I absolutely agree with that. This episode has been graciously sponsored by California Cryobank. California Cryobank is the #1 sperm bank in America, but they've been particularly special to me because not only do they do a great job with their medical screening, but they do a fantastic job with psychological screening. They follow all the guidelines set forth by the American Society for Reproductive Medicine, and that is so very important to me and will be important to you and your future family. So you can rest assured that your donor is screened appropriately. And for you lucky listeners, if you enter the code PREGTOG, you will get a free level 2 subscription to their donor catalog. It is a fantastic deal. So check them out, California Cryobank. You will be happy you did. Something that I mentioned to you earlier is the kind of more kind of traditional gay male couple very often comes to me and they don't have ovaries that are aging so quickly. So that's taken care of by a young donor. They have a surrogate, and so they've got a good, healthy uterus that's kind of proven to work. And so their chances are super high. And so they're kind of, if all things work out, they kind of move through the process and feel really excited. And then the pregnancy gets near the end and they say, oh my God, what do I do? I can't handle a baby. I'm not a woman. And I often say to them, well, I didn't come with instructions either. And I didn't know how to take care of my children either, but they don't believe it. They feel so worried about, how do you take care of a baby? How do I understand delivery process? How do I understand what to think about? How's the baby growing? It's so confusing and so frustrating, I think, not to feel like you have insight into something which you couldn't possibly have insight into. I mean, the first time you're
Right.
pregnant, you don't know what happens. You don't know what it's like until you've been there, right? So it's the same is true for people with ovaries. And so I'm wondering, do you see that a lot in your practice? And if so, how do you handle those couples?
I talk to everybody about it, whether they're gestating the pregnancy in their own body or they have a surrogate or their partner's gestating. Like, there is no way to be prepared for becoming a parent. It's a profound transformation that happens on every level of our being, that there's, even when the baby is growing inside your body, there's no way to feel completely prepared. And so I really encourage people to normalize that, to get comfortable with the idea that they are going to change, their lives are going to change. Like, let that happen. Don't try to keep things the same because they can't be, because your family is evolving and you are evolving. I do think it is a different experience when you are not the one gestating your child. And I do a lot of work with non-gestational parents. We have a monthly support group and a chat room specifically for the
Great.
non-gestational parents, which, I'm a non-gestational parent of my 2 older kids. And it is different. It is a little bit different. Not that my love and connection for them is different, but the experience of gestating a child, you're forming a relationship with them in the beginning. And when you're not gestating, your relationship really begins when they're out. And that's not entirely true depending on the relationship that folks have with the surrogate or if their partner is gestating. But I think it's important just to have a space to center your own experience about that and feel validated in your own experience of becoming a parent in this way.
Mm-hmm.
And then, there's the practical stuff. I have a workshop on newborn care, and I do, a little infant CPR training. And, there's different things that I think can be helpful to feel a little bit more prepared. In my newborn 101 workshop, I have lots of pictures of newborn poop and what that looks like, and skin stuff, and, listening to them breathe. And, there are a lot of things, especially in our culture, when most of us don't grow up around a ton of newborns. So getting familiar with what newborns are like can be helpful. And knowing that there's always a learning curve and it's going to be hard and overwhelming and beautiful, and it's just going to change you.
Yes, it absolutely changes you, parenthood. There's no question about that. But it's such a difficult journey for so many people. And I think you said earlier that you also run groups for people who have had losses or, early losses or late losses, and have had the experience of so many different sorts of losses in their process to become parents.
It can be a long and arduous road for people. And I think, especially for queer folks, no matter how they're growing their families. I mean, I don't think we talk about miscarriage and infertility enough in society in general. And then also that experience of growing your family with donor sperm, having a gender identity that doesn't fit into that dominant narrative, that can just feel extra challenging and isolating. And I think a lot of internalized stuff can come up in that process.
Yes,
people feel like
sure.
It's their fault. And then there's internalized homophobia or transphobia.
Yes.
I think we get these messages as young people that we're we're not supposed to grow our families, or, there's all these sort of covert messages that get in there. Exactly. So I think I do see that come up for my people that are going through miscarriage and infertility, and that can be a big challenge. And I try to talk about it and remind people that it's not true. It's not some inner knowing or God or whoever, having some power over you. It's just, it is something that happens sometimes to 1/3 of pregnancies for, mostly reasons because of the fetal formation process doesn't quite go according to plan. And bodies are generally very, very intelligent in their design. And it's just kind of part of how human reproduction works. But it can be hard, and, especially when there's so much planning and intention and money and so much vulnerability that goes into this process.
Yes, so much vulnerability, so much. Mm-hmm. Speaking of which, one thing I also talk a lot about, which you probably experience, is the experience of the non-genetic parent and what that feels like when, on one hand, if, let's say, the woman who's the head of the PTA knows that one parent is genetically connected or not, and therefore that woman who's the head of the PTA is now looking at your child and looking at the genetic parent as if this child is supposed to be just like that person, which kind of pigeonholes the kid and also can leave out the other parent. Or on the other hand, if you feel like you're not comfortable sharing with that person and you have every reason not to, and I feel like people need to honor that, it can also be hard because you're walking around with this secret, it feels like, right? You're not sharing with people, or it can feel weird, or it can feel uncomfortable. And so some people kind of honor one or the other, and they find a path that's right for them, hopefully eventually. But I think that can be such a struggle for people to get to a place where they're comfortable, where they feel ownership over being a parent, even if they're not genetically connected, and then having to deal with the whole outside world's reaction.
We talk a lot about that in the non-gestational parents support group that we have. And I think there's the internal feelings and then the external world. And, I will also say, like, that's not just an issue in the queer community. I think, we're seeing now with things like 23andMe that a lot of people are finding out that the people that they thought they were genetically related to, actually, maybe they're not.
Yes, all the time.
Lots of covert donor conception happening, and now we're having conversations about how essential it is to talk to our kids about their donors and how they were conceived. But back, 20, 30, 40 years ago, plus, people were encouraged to not talk about it. And so I think the whole notion that family is biology needs to be questioned and broken, because family is the relationships that we create. It's the relationships that we verb through our love and devotion every day. So I hope that as a society we can move past that biology question. It's complex because it's not to say that biology doesn't matter, because it does. And I'm learning more and more about the rights of donor-conceived people and the conversations that donor-conceived people are having around access to their donors or information about their donors, and that's important and should be honored as well. And so I think there's just a case to be made for expanding our vision of what family means in general, and that it benefits heterosexual families, like traditional families. It benefits all of us when we expand those notions of what family means.
Absolutely. Absolutely. You're singing my tunes.
Yeah.
Yes, absolutely. I'm all about that for sure. And it's so hard. I mean, yes, I agree. And there's so much infertility now and so much donor conception in the straight community. But I think the added complication you have as a queer couple is you can't just walk down the street and people not wonder who's genetically connected, right? If you're a straight couple, unless they know your history, they're not going to ask you. They're not going to think about it. They're not going to be staring at the kid and staring at you and wondering who's genetic. You're not going to have all of that.
Right.
So I feel like you've got this kind of added layer there. And
Right.
I agree that, until we kind of understand family is what you feel your family is, and everyone's entitled to their own opinion about that, until we allow people room for that, it's going to be difficult.
Yeah. And I think that's why it's really important to have spaces where you feel completely seen and safe. And, when the world isn't reflecting that to you, it's really important to have a
Mm-hmm.
place where you can come to be like, this happened today. And has anyone else experienced this? And, being able to come together around that experience, I think can help reinforce some resilience when we have to go out in the world and be faced with some prejudice around the legitimacy of our families.
Yes, I agree
Yeah.
100%. Well, it's so wonderful that you provide all of that. So, are you also providing services as a midwife still, or are you
I
mainly involved in your
am.
community? Oh, you are.
Yeah. So I live in Santa Cruz, California, and I do at home inseminations and consultations. And I have a very small home birth practice right now with some select clients. But my main focus is growing Pregnant Together and getting the word out and hoping to expand that so that more and more folks have access to it in the coming years.
That's great. So,
Yeah.
must be nice to have this balance of different sort of skills that you get to use.
It is. I love the in-person care. I love being a healthcare provider. And I also really love being able to connect with people from all over the country and all over the world. I've always been like a community person. And so, I think with the pandemic, and Zoom becoming a thing that everybody uses and, just virtual spaces becoming a little bit more widespread, I think it actually really facilitated the birth of something like this. And I'm excited about the power that we have now to be connected to people all over the world. And, it's really touched me. We've got a couple in Slovakia, talking about just the very different challenges that they face around legal recognition as a
Oh, yeah.
queer family. And they do have access to IVF and fertility services and, but they can't do second parent adoption and all these different things that in the US we talk about. And, I have resources for where to get legal support. We have a section for sharing the known donor contracts that people use in different states. I always recommend that folks consult with a lawyer in their particular state, but we are sharing resources, within the community that are kind of unique and helpful for folks to have access to. But yeah, just hearing about this couple's experience in Slovakia and how privileged we are in so many ways in the US and imperfect in many ways as well. But
Oh, gosh, yes.
being able to just connect with folks who's have different levels of barriers and be a home base for people all over the world is really exciting to me.
There are many places in this world where we're not so privileged to be able to make these decisions about what we want our families to look like and who we want to love. And so I am very grateful every day for that we do live in as imperfect as it is, a society
Mm-hmm.
that, where we can have, some of these freedoms and at least have some of these conversations. And it's beautiful that you have this platform that people can access. Sadly, obviously they can't access it in China, but in most places they can get on the internet and access this and receive some support. So that's wonderful.
Mm-hmm.
Really
Thank
beautiful.
you.
You're welcome. Is there anything else that I missed? Anything else that you think our viewers should know about or be thinking about?
I think a lot of us start this process with some naiveness around how it might go. And I think, being able to respond to the changes is one of the most important things in life. I was very lucky to get pregnant pretty easily in my journey, but then some years later, my co-parent and I are going through a separation and divorce process, and I feel
Mm,
like it's sort of given me a window into my own experience of my plans and visions for my family not working out in the same way that I hoped. And I think people go through that at different stages of the process often, whether it's a harder conception process or a loss in early pregnancy or, any number of things that life throws at us because life is hard and full of surprises. And I think when we're tapped into community, when we can, connect with other people going through similar things, it really helps. I know at the beginning of my separation, I joined a community where there were other separated and divorced parents. And that was so helpful for me in getting through that time. And so I just think there's a lot of power in that. And so that's what I'm excited to be providing for folks.
I'm so sorry that you're going through that. That's awful, but
Thanks.
I'm so grateful that you're sharing it so openly here with everyone, because I think, again, it's really hard when you're focused on one thing to think about other things. I often say to people who choose a known donor and they say, well, this is my best friend from college, and we were friends for so long, and I know he's going to be this great sperm donor, and we have it all worked out, and it's going to be great. And they don't think about the fact that, most marriages end in divorce in this country. So if there's somebody who you're not in love with, right, he's just a friend and he's going to donate sperm to you, how do you know that that's going to work out for sure, right? You don't know for sure.
Well, you don't. Maybe it is helpful that they're not in love / sexual partners, though, because sometimes that can be a little tricky.
Maybe.
Yeah, but I think yes, holding
it's important to think.
It is knowing that you can try to control everything in your power, and there's just no way that we can do that. It is important to think about the contingency plans, and be prepared for things, looking differently than we plan.
Especially because ultimately we have to think about the kids, right? If we make an arrangement like that with someone we don't know, we have to think about how it's going to affect our children. If we decide to go through home insemination, we have to think about, is this ultimately going to get us pregnant? All of these things, I think we have to also think about what's going to happen in the future.
Yeah. And it's hard. We never know the answers. And it's hard sometimes to find that information. And so, that's why we wrote the book, Baby Making for Everybody. And it's helpful to talk to people like you or me or other people in this space, because it's a whole world that a lot of people don't really know a lot about.
It's true. And where can people get your book?
So my book is available anywhere books are sold. You can get it on Amazon or Bookshop. We have a website, babymakingforeverybody.com, that also has some free downloadable resources that you can download. Right. And then you can find Pregnant Together at pregnanttogether.com. And then Instagram is at pregnanttogether.community.
Terrific.
Yeah.
Well, thank you so much for sharing all this great information with us. I'm so grateful to have you and to have Pregnant Together out there in the world that people can access. So thank you for creating that. And hopefully we'll stay in touch and be able to have more of these discussions in the future. I think it's wonderful what you're doing.
Thank you, Lisa. Yeah, I appreciate you having me and feel the same way. And would love to keep chatting. And thanks for all the work you do to support queer families as well.
You're welcome. And thank you all for coming. We really, really appreciate your support and your help and you listening. And if you like this episode, please subscribe, because that's how we keep going. And I will see you next week. Hi, it's Lisa Schumann. I hope that you enjoyed that video and I hope it helped you. And if it did, please give us a thumbs up and subscribe, because that's how we keep going. It's really important to us. And if you liked it, you might like this one.